Welcome to the fifth episode of our Page Health Huddle. Today will be a more casual session. Since the last 2 weeks, we have been talking about topics around children learning mental health, and also last week we talked about vaccination. And today will be me. I'll be hosting the session. Again, I'll introduce myself. My name is Wei-Chen, and I'm actually the co-founder of the company Advanx Health. And together with me is our co-founder as well, is John. Will be joining us on this fifth episode of Health Huddle, which is supposed to be episode 3, but then due to some of the issue, we have delayed to today. And so both of us will be talking about pharmacists, things that pharmacists want you to know, be in the community side or also be on the normal circumstances. This is Health Huddle is a series of Facebook Live, or rather an interactive session that we have every Wednesday at about 8 o'clock at night, and we talk anything about healthcare, wellness, and also genetics. As genetics is part of what we do in Advanx Health, we basically provide a genetic testing through consumer channel or also direct to consumer. So for those who are interested, you can check out our website advancehealth.com, or you can also follow our page for a lot more information about genetics and also healthcare and wellness. So today's topic, we are talking about pharmacists, because both of us, John and me, we are actually pharmacists by professional, and then we will be talking and also discuss about things that pharmacists want you to know in the retail setting and also in your daily life. So we will call this series called Pharmacist Talk, where we give you insights about, from a pharmacist perspective, what is the life of being a community pharmacy, or what we want you to understand, why sometimes pharmacists try to tell you something else. So okay, so we will be splitting into few small sessions or a few smaller talks, and then so a common thing happened between me and John is, first of all, we study pharmacy. Secondly is we've been knowing each other for, I think, close to 7 years right now. We know each other ever since we study in university, but of course we don't study in the same one. I study in USM Penang, while John studied in Cyberjaya, 𝗧𝗹𝗹𝗀𝗀. So we met each other through events that pharmacists often organize together, student events. And then when we graduated, we also embarked on a sort of like a similar journey where both of us work as a community pharmacy. So what is a community pharmacy means is we basically work as a training pharmacist in retail pharmacy or individual pharmacy. So I practice my pharmacy in Johor in a chain called 𝗵𝗵𝗿𝗀𝗄 where John practiced in a pharmacy. Was it in Bangi or
Kajang.
Yeah, in Kajang, called 𝗣𝗵𝗵𝗿𝗀𝗄. Called
Yes.
𝗣𝗵𝗵𝗿𝗀𝗄. So we, in order for us to get a license, become a fully registered pharmacy, we need to undergo at least 1 year of we call a training pharmacy, or in a more specific term called PRP. So both of us has our training pharmacists in a retail setting. So we are a little bit different from maybe our peers who practice in hospital. So hospital pharmacists has their own set of training, while we call ourselves community pharmacy. We also have our own set of trainings, and then we encounter very differently in terms of people that we encounter every day, as in people who walk into a retail pharmacy generally are different from people who visiting a hospital. Okay, so here comes to our very first topic. We want to talk about something very common in Malaysia, or I would say people in Malaysia know this term very well. It's what we call antibiotics or antibiotics, right? So let me ask John. So what is in a very brief? So what is antibiotics?
So, in a very brief manner, antibiotics is a medicine or a drug that kills off bacteria that causes infection in your body. Typically, it may be like a throat infection or on your skin. Certain antibiotic creams, but mostly is to kill off bacteria. Yeah.
Okay, so I think antibiotic is something very common in Malaysia because um, people just know antibiotics like very well.
Yeah.
So I think when we work as a community pharmacy, one of the thing that we always face is people will walk into a pharmacy and tell us, can I have okay, maybe they will start with I have headache and then I have fever. Can you give me antibiotics? So as a community pharmacist, are we allowed to do that? I mean, are we allowed to just give antibiotics to a patient or to a customer who just walk in and tell like, oh, I have a fever and cough?
No, actually, pharmacists are not allowed to dispense antibiotics without a valid prescription.
Mm-hmm.
And antibiotics are, being dispensed solely if, let's say, you are being confirmed with the bacterial infection. Yeah, so I think a lot of cases I also encountered myself during my training. A lot of people they just ask for antibiotics if they sort of like a flu, things like that. But our pharmacists in DF, previously when I trained, we do not dispense. We will ask them to see a doctor instead and get a prescription. Yeah.
Yep. So I think it's a very similar experience happened between uh, a lot of other community pharmacy. I think a lot of people can relate to this is people will always tend to relate taking antibiotics is the cure towards solving all the flu, a cough or fever. I think this is something that we cannot blame the public because maybe they have been sort of trained in a way where or even young, like I would admit that when I was young, um, when I was going through any fever or that, all I know is I would take antibiotics. And then one of the thing that for antibiotic is my mom always tell me that I need to finish my antibiotics. So okay, we'll talk about this later why we need to finish our antibiotics. But uh, just want to instill that maybe this is something has been happening to us so often until we stuck it on our mind that if you have flu, cough, fever, um, then or even sore throat, then we need to take antibiotics. But then John just now pointed out a valid fact is actually antibiotics is only for bacterial infection, which is maybe more commonly happen for children. While as for adult like us, when we're going through a normal flu, it very likely is going to cause by virus infection. So bacterial infection and virus infection is a little bit different, whereby antibiotics is solely just to give for bacterial infection. So when we have a virus infection, if we take antibiotics, typically, or I would say 99%, it will not work because virus infection and bacterial infection is very different. So a lot of cases when an adult like us, when we have a normal flu, if you go to visit a doctor, I personally experienced a case where I was waiting outside for a doctor in a clinic, and then I heard someone inside the um, the uh, the room was shouting at the doctor where why don't you give me antibiotics? Like you have diagnosed me with sore throat, fever, flu, and then I don't see antibiotics in my in my prescription or or in a pack of drugs that you give me. So I think this has a lot for pharmacists or healthcare professionals to educate people. And this is why we talk about this topic today. Is antibiotics is not for every normal cough, flu, and fever. It's only very targeted just for bacterial infection. So, so that brings to the second topic we want to talk about is you often know. I think we started to educate people like antibiotics you need to take in a full course, meaning that if you started to take antibiotics on the day one, you need to finish all your antibiotics based on the period of prescription that the doctors prescribe to you. So why we need to finish our antibiotics?
So, so for antibiotics, as you know, we previously mentioned just now, is to kill off the bacteria. And once the doctor sort of diagnose what sort of infection it is, then antibiotic course would be started to sort of kill off the bacteria. The main
Mm-hmm.
concern for us, if you do not finish, in the public, do not finish the antibiotic, is that it will cause, it will not kill off the bacteria completely, and those that are not killed off completely, it will create like a resistance. So
Mm.
antibiotic resistance would be the main issues that a lot of pharmacists are trying to tackle in the hospital settings, where a lot of antibiotics are not useful anymore if you are resistant to it.
Yeah. So I think this is also something. It's about public awareness. So for those who just tune in, we are having a discussion together between me and also John.
Yep.
Both of us are pharmacists by professional, and right now we are talking about things that we pharmacists wanted to tell people, or things that we pharmacists hope the public would know when we are practicing our role. So right now we are talking about antibiotics, and then we stumbled upon about this uh, topic about we should finish our antibiotics. Um, I think John mentioned that why we should finish our antibiotics is because even though, let's say, you are supposed to have your antibiotic course for 5 days, and then normally you will recover from the sickness or or your illness at maybe on day 3, and then you start to feel I am I am already sort of like recovered, and then you might want to stop taking medication, and then you might felt you need to stop taking antibiotics. So that is not the right way to do. You can of course stop taking flu medication, or you can stop taking uh, 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 Panadol, which reduce your fever, but you should finish your antibiotics. It's because John has mentioned that we need to kill off completely the bacteria in our body. Um, just now, John also mentioned something about resistance. Antibiotic resistance has been a big issue, and it's going to be a bigger issue in the future if we misuse antibiotics. So, how do we misuse antibiotics? Is just like when we practice as a community pharmacy, we don't give out antibiotics simply. It has to be based on a doctor prescription, has to be a valid prescription, and then we need to ask a series of questions to the customer who requests, and then we only give antibiotics. It's because we don't want just simply give out antibiotics and then people just take antibiotics like vitamin C or like a normal supplement. Because this will contribute a very big issue into antibiotics resistance, whereby maybe in the future um, some of the antibiotics that currently we are using will not be usable in the future, and then the bacteria is going to be smarter, and even smarter, just outsmart the drug that we invent. Just like how coronavirus was getting so smarter as compared to like maybe MERS or even SARS. So this is the reason why we should not misuse antibiotics, is because uh, it helps the bacteria to fight against antibiotics, and then it will make a lot of resistance, which cause um, a lot of different other antibiotics will be not in use in the future. So, uh, so a small conclusion about antibiotics is, first, antibiotics is only for bacterial infection. Secondly is not all the illnesses like flu, cough, fever has to be cured by antibiotics. And then antibiotics has to be are given based on prescription. So if you walk into a normal community pharmacy, antibiotics should not be given without any prescription. And lastly, if you are prescribed on antibiotics, you should finish the course of antibiotics. Okay, so if you have any question for us about antibiotics or or anything that you want to know about antibiotics, you can comment below, and later we'll revisit the topic again.
Yep.
So so right now we will move on to the second topic, the second small topic that we want to talk about. It also something related about medication. It's about taking pills. Okay, so if you have taken any pills before, you will notice that there is different type of pills. It can be in a capsule format. It can be uh, a normal pill, just like Panadol without having like a cap, which should fill medication inside. So they are risen into different pills that is being invented by the companies. So first of all, I think when we talk to patients or when we talk to customer, so one of the things that we always tell about when you're consuming pill is this is something that I learned from a very senior pharmacy back in the retail pharmacy that I work with. Is we always encourage people to take medication only with plain water. So this is something happened to me when I was young. Was my babysitter would ask me to take would ask me to take medication with soup or with tea or sometimes even with coffee. So only when we learn about studying pharmacy, only we know that actually the best way to consume a pills is only through plain water. So um, so John, have you
Yes.
encountered anyone tells you about I want to take Panadol with Coca-Cola, or I want to take pills with other different drinks?
I think so far on my own personal side, I never encountered any customers or patient who said that to me. But I think on personal basis, sometimes we do take pills with maybe our coffee, morning coffee, certain supplements,
Mm-hmm.
with our milk and stuff. Yeah, I think it does probably affect some of the absorption, and you should not probably do that. A lot of people might, tend to have their tea with their morning medication or whatnot. Yeah, I think, like you said, it's best to be consumed by using just water.
Yeah, because we will never know that if the medication will have any interaction with
Exactly.
the with the drinks that you took together. So it could happen that the particular drugs has a certain interaction with like black tea, for example, and
Yeah.
that will actually cause either how your body absorb the medication or how your body actually digests and metabolize the particular medication. So the best way and the best advice that we always give to customer and patient is to consume pills with plain water. I think that is the best case. Okay.
So we do have like a comment in the comment section right now. Miss Jane is asking whether, what about swallowing pills without water at all? What do you think? Have you tried swallowing pills without water at all?
um, I did if the pills are very small or or if I don't have enough water with me, I think I will do that. But then maybe a lot of people will face trouble taking pills without having water, or even if with water, there are also people having difficulties taking pills, um, like maybe a larger pills, or they will need to split into half. So I think for me myself, I have tried with very small pills, but I never tried and I don't dare to try with like large pill because it sounds a bit scary if the the medication or the pills get stuck on my throat, right? What about you? Do you have any experience about that?
I cannot swallow without any water at all. I think no matter how small is the pills, and I think it's gonna cause any choking hazard, um,
Yep.
and most of the times the formulation in a pill, if you just swallow it without water, if the taste stays in the throat, it will have the bitterness taste. Yeah, so but technically, I think swallowing pills without water should not cause any interactions, but more to discomfort. If the pill is like too big of a size, you might choke,
Yeah.
and that would cause some issues. I think most Asians like us, we have a slightly smaller throat compared
Mm,
to maybe our European or Caucasian counterparts. I'm not sure about this, but I don't think it causes any issues other than you might choke when you swallow the pills without
yeah.
water.
So So when you practice as a community pharmacy, what are the normal advice or normal suggestion that you give to patient if or customer if they complain about um, they they having difficulties in getting pills, or any real cases that you have encountered before about consuming pills, like difficulties or or they just have like a different alternative.
I think that's quite a good question because there are a lot of issues swallowing pills even for adults, let alone
Yep.
for children. Most of the time, if it's children, then we would of course go for a syrup alternative. For example, the common flu syrups, the cough syrups, even Panadols, all the fever syrups. So for that, it's relatively simple. For adults, the easiest way for me most of the time is also recommend syrups.
Mm.
But because the dosage will be different, if let's say they really can't swallow a large pill, a lot of times they would ask whether can they smash it and mix with water or whatever. I think so. This comes to another point that we also want to educate the public, where not all pills are meant to be crushed. And not all pills are meant to be split unless there's a score,
Yep.
there's a cut there. So normally what I do is to find whatever alternatives available in the store. Otherwise, then I would just if it's a doubt, probably I'll ask him to try our best, and drink it
Yeah.
down.
Mm.
Okay. Probably also to share to our audience here is the sort of more official way for us to handle this issue is through what we call an extemporaneous preparation, where the pharmacist can prepare a small dose of syrup based on whatever actives or pills that is meant to be crushed. But those are additional service that not all pharmacists might provide.
Correct. So, so just now John mentioned something very interesting. Is about crushing pills, and then something actually flashed through my memory was, I think I remember when I was also a kid, because my babysitter uh, um, was taking care of me and my sister for largely of our life, because my mom is a working woman, and then most of the time we stay together with my babysitter. So maybe the generation before that was not too exposed to a lot of this kind of information. And then I remember that there's one time my sister refused to take medication, and and my babysitter actually crushed that particular medication and mixed together with a cereal, and then just give it to my sister. So again, we are not here that to encourage this is the right method, but then we just want to bring out that um, it's very important for us to have a conversation like this, to interact with the public, and then to sort of like debunk some of the myth around maybe medication, around what pharmacists want all of you to know. So uh, generally, we don't encourage customer to or patient to crush the pill. You should take at the very original form, unless for example, doctors give you this particular medication should be just 5 milligram, for example. But there's no form of 5 milligram pills available. Then so you are being prescribed with a 10 milligram pills. So then you are allowed to actually cut the pill into half, and then that will serve up to the 5 milligram doses. So there's also a pill cutter, a tool being sold in a normal pharmacy. You can always find that. So that is a case where you're allowed to actually do anything with the pill. But other than that, normally we do encourage you to take in a very original form, and then and then and for those who are in a capsule format, you are not supposed to split the capsule and then look into the medication inside. So the capsule are designed in a way where it will be dissolved in your body, and then you can be absorbed. Um, so
I think probably one thing for us
This
to
bring to a real cases.
yeah, just wanted to highlight, for our listeners here is the reason why certain pills are not supposed to be crushed or certain capsules are not supposed to be open. It's because we have a very strong protection system in our gut, which is our stomach
Yep.
acid. Most drugs would be destroyed in the stomach acid region. Certain drugs would cause your stomach to be discomfort. That means you will feel you have a bad stomach ache or something if you consume it directly. That's why the certain pills, certain capsules are being formulated in a sense to protect the stomach acids to that attacks the medication inside the capsule, and to sort of digest afterwards, in our intestine. So that is the reason why certain pills are not meant to be crushed. Yeah.
So I would say medication that are available in the market or available in the community pharmacy are the medication that has been approved by either the FDA and also being approved by our own Malaysia MPRA. So all the medication are made in a way to not only protect you but also to give you the best outcome.
That's right.
So
That's right.
so I think this will bring to the next question, I would say the next topic. Is about there are drugs in a similar maybe somehow the name are pretty similar, but they are also somehow different. So I think I'm not sure if the public are aware of there are what we call generic drugs, or versus another what we call innovative drugs, or maybe somebody will say original or branded drugs, right? So today we will be also sharing a little bit about what is generic drugs and then what is innovative drugs. So John, can you
Yep.
just briefly tell about what is innovative drugs and what is a generic drugs?
Yeah, so recently I also had a friend who asked me about that. Basically, innovator drugs, or we call it original drugs, they are the company that found out the drugs and sort of formulated and patented it in the first place. Whereas for generic drugs are basically companies that sort of, I would say, make a new copy of it, equivalent to the original, after the patent has expired from the original company. So basically, the difference would be, let's say today, Wei Xuan, he found a new medicine compound, and he patented it and creates in the form of pills or drugs. Then he will be the original brand of drug. Let's say, for example, Wei Xuan Mall or something like
Yep.
that. So then, let's say after 20 years, when the patent expires, then only then I am able to allow to sell that particular compound uh, as a drug. So I will be the generic company that does so. Yeah.
Yeah. So let's give a few example. I think the most famous one would be Panadol. I think everyone would know Panadol, and Panadol sort of like has become the name, the household name that represent actually the active ingredient is called paracetamol. So so when we study as a pharmacy student, we don't study the brand name. So just like we don't study what is Panadol, but we study paracetamol. So paracetamol is an active ingredient that is inside the pill, where Panadol is the brand. So for example, uh, okay, let's take an example Milo, right? So Milo is actually a brand,
Mm.
but inside Milo is the ingredient is maybe cereal, there are cocoa, but Milo has become so famous that it almost represents all the chocolate drinks. Right? So this is how successful Panadol is. So today, if you walk into a pharmacy, um, if you ask for Panadol, but then when you receive the package, it was maybe named like 𝗪𝗵𝗿𝗺 or whatever more. It's actually this is what we call the generic drugs. So Panadol is an innovator or what we call original drugs, and then the generic will be other brand but using the same active ingredient paracetamol, and then they sell it in their own brand. So of course, innovative drugs are being protected. The patent for I think it depends, right? Maybe 15 years to 20 years.
Yeah, normally it's about 15 to 20 years now.
Yeah. So let's say today, me and John invented Panadol. So the day we submit a patent, and then it got approved by FDA, WHO, then we have the patent for maybe 15 to 20 years. So within 15 to 20 years, we are the only one that can sell these particular drugs, paracetamol. But when that patent expired, then the formulation can be used by other generic company who want to produce their own generic brands of these particular products. So I would say in order to have innovative drugs, normally comes from a very, very big scale of pharma company, like GSK. So GSK is the company that owned Panadol. We also have like the recent famous pharma company called Pfizer, who will be supplying Malaysian the very first vaccine that we have. So Pfizer is also one of the very, very big pharma company who they very focused on doing research into building their next innovative drugs, the next molecule that can cure the diseases. So another very interesting innovative drugs owned by Pfizer is called Viagra. So for all the audience that you heard about Viagra, you can type in the comment what does Viagra does, right? So Viagra is one of the most famous drugs that is invented by and owned by Pfizer, and then right now they also started to have different generic drugs that is similar to Viagra, or the active ingredient is what we call sildenafil. But then Viagra has become so famous that whenever people walk into a pharmacist, like every time when I encounter a customer who asking for this, they will not tell us, oh, I want a sildenafil. They will ask us, I want a blue pill, or they will say, I want Viagra, right? But generally, if you don't have the Viagra brand, then we'll give them other brands like other generic drugs. So this is a way this is one of the way we want to educate the public, where generic drugs versus innovative drugs. Generic drugs has actually almost a similar function as a normal innovative drug. So, and that's the difference why we have so many different brands, but then the active ingredients are still the same. And generally, I think generic drugs is slightly cheaper than the innovator drugs. I think that is a very common thing happening around. So if you're looking for a cheaper option, I think normally pharmacists will recommend you a generic drugs. But if you insist want to have a branded or original drugs, then you will take those probably more expensive drugs, right?
Yeah,
So
I think I also like to share a part where I also encounter customers who came in, sort of comparing the original or branded versus generic, and have the perception of saying that certain generic drug is of low quality, and original drug is about more high quality imported drugs. I think the point here today is we also like to educate our listeners here that from the active ingredient point of perspective, if the medicine is registered via MPRA, it's actually equivalent, because there will be a study conducted when they register the drug. It's called a bioequivalence study, thus showing equivalent quality, if not better, in certain cases better, in terms of the drug. So doesn't mean the more you pay, the better you get. There are certain values. For example, the original drug company may have done more research on the drug, the formulation itself, or they will have certain formulations that they would sort of patent further. But then most of the time, if it's the same molecule, same combination, is of same quality. And of course, safety is being protected as well. Yeah.
Yep. So I think one of the reasons why generic drugs exist is also because to increase access to healthcare. If you imagine Panadol can be only manufactured by GSK, we have so billions of people in the world, and GSK has only that capacity to produce that much of pills. And then if this particular drug's only dominated by one player, the access to healthcare will be a very different versus different class of people. So the existence of generic drugs is to increase access to healthcare and also allow fairness among people from different classes have access to the similar drugs that the other classes of the people have it. So this is why generic drugs happen. If you can't afford to have like a branded drugs, there's always a cheaper version for you. But then the efficacy and the effectiveness is always there. Right. So we have a comment from one of the audience saying that one of the thing that I presume that he also a pharmacist is. So this is the last probably the last sharing that we will do today is we want to bring out the role of a community pharmacy. So when you walk into a community pharmacy, right, you will often ask about, hey, Mr. John, I want this particular medication that I bought last time, which is white in color. It's a very small pill, and I think if I not remember wrong, it's about 10 pills in a strip. Can you give me that medication? So this is the common thing that we want our customer to know, that if you just give us the description of the particular pills, 99% of the time we couldn't tell you what is the drug. There are so many drugs is bulat punya, kecil punya, or putih punya. Right now I can name at least 10 drugs that have the similar characteristics. So if you want to request for medication, what is the best practice is either you bring your prescription. I think that is the best case scenario, because if you look at a doctor prescription, we will know exactly what are the medication that you need, and then we will check for you how long should you take the medication, and then and we also can check with the doctors if you still need to continue with that particular medication. Or the other way that you can do is you bring back the strip that you have already finished, or you have took a picture, you show us a picture. I think this will be they will also help us to identify the medication that you try to request. And the last would be if you tell us the indication for the medication. Of course, this also will be a bit difficult for us because there are several drugs maybe for the same indication. There also could be the different indication could also be using a similar drug. So for example, if you're having flu, like runny nose, and you have skin sensitivity, actually we'll give the same medication, because that medication works for both indication. So I think the best way is give us prescription. The second best is you have took a picture of the particular strips or particular medication, and then you show us, and then we will give you accordingly. Yep, John, you have anything to share?
Yeah, I think if let's say if you do not do that, it will be your pharmacist will do something like me. So what I do when previously when customer does this, then they say, oh, I want this pill, this pill, white color, with a score, how big, very small. What I would do is like what Vishen mentioned just now. I'll ask what is it for. Most of the time, it's not for chronic conditions. It's not for like hypertension,
Yep.
Diabetes, because most people who takes that in a regular basis, they will know what it is.
Correct.
Most likely is for like flu or I think pain most of the time. So what I would do is I would just give them the medication that they need. If it's a pain, then we'll have a painkiller for them. If they say, oh, it's not this, it's another one, then I will just say it's the same one. I will convince the customer actually it's the same, it's better. But it's not technically better, but it's the same thing, just a different brand. It does, because most importantly is for us to solve the issue first. Not identifying the right brand. So pharmacists is not pure identifiers. We are more to solving your symptoms. I think that's the important thing.
Yep. And then we as a pharmacist, we are also not receptionists.
Mm-hmm.
So by saying that means we have the responsibility to always check the particular medication that you are currently taking. So we may ask questions like how long have you been taking the medication? Why are you taking this medication? Do you encounter any side effects? Whatsoever. So there's always customer who are a bit fed up with like they just ask like, why you ask so many questions? Just give me my medication. So I personally encountered a few times before because when I was very new to the community pharmacy, to be frank, it takes time for us to familiar with all the medication being sold in a community pharmacy, because it could be very different from what we study in our university. Because in university, we probably more towards hospital care, meaning that we study a lot more onto sort of like tertiary healthcare, hospital pharmacies. But when it comes to retail, there are so many drugs that we need to learn, like maybe just one diabetes drug. There are so many different brands out there, so many different dosage.
Yeah, and I think probably the combination drugs that I think is also new to the market.
Yeah.
That we don't really study much in our uni times as well. Yeah.
Yeah. So being a responsible pharmacist, we always ask question like, how long have you been taking it? We also will check if you take it correctly. Like, is it before meal? Is it after meal? Is it night? Or is it in the daytime? And then we'll ask about do you experience side effect? Because if you experience side effect, you might need to visit your doctors again to tell him about the side effect that you are facing. It could be a normal side effect, like if you take a vaccine, then you'll probably have fever. I think that's common, that's normal. But then we are afraid that if you are experiencing any severe side effect, which means that that particular medication could not maybe not suitable for you, then you need to switch to another medication. So I think for our audience today, if one day you walk into a pharmacy and then you try to request for medication, and then that particular pharmacy, a pharmacist trying to ask you different questions, I think just be patient, because we just do our role. Like we want to make sure that you are doing okay with this particular medication, and then just try to be more cooperate to the pharmacist, and then try to understand the situation each other. So I think this is one of the responsibility as a community pharmacy, where we want the best out of you. And then and again, the community pharmacists are not pure identifier, and we definitely not the receptionist. So we study 4 years is to help you to get the best out of the outcome of having medication. And then and always
I think I think to add on, like what pharmacists can help you with, it's there are a lot of things pharmacists can help you with. So for example, smoking cessation, pain management, wound management, weight management. There are a lot of other services that you can inquire in any of the major pharmacies right now. And pharmacist role is most of the time is to ensure that medication is safe, efficacious, and of quality. So I think most of the pharmacists, when we study 4 years, we are passionate to serve the community. So do give us the opportunity, to practice it right. A lot of times, it's just a simple question, like, how long are you taking? Is it okay? Is it under control? These are very normal questions, and don't feel like, we are nagging, because every time when we ask the same question, we might expect a different answer. We do not know. Yeah. So yes, that's the thing.
Yeah. So for those who are listening, if you have any question for us, you can type in your comment. But I think we are a bit running out of time. Maybe we'll take one or two questions to answer. So I think to wrap up the session, John mentioned something very close to all of us who are in the pharmacy field, who study pharmacists. It's really about serving the community, and then both us and our doctors or nurses or dentists, we play a role in what we call primary healthcare. So primary healthcare is typically your normal clinics, your normal pharmacy, or a dental clinic where you can access in a daily basis. Because if you talk about hospital will normally treat more severe cases, and you normally might need to make an appointment in order to visit a hospital. But then in clinics or in pharmacy, you can actually just walk in, and then it's actually very accessible right now. I think even if you look at the city like Petaling Jaya or Selangor, one row we have like 2 clinics, 3 pharmacy. So whenever you face any issue, I think it's always good to talk to a professional. And then pharmacists and doctors, we are always here to help you with your health issue. This is something we study as a healthcare professional, is to really serve the community. And then especially during this pandemic time, I think a lot of people are facing problems with do they have COVID, do they don't have COVID. So even for us, although we are running a company who primarily does genetic testing, but then every day we also receive question about COVID question, and then we try to lead them to the right uh, uh, places to get testing, or we also give them like CPRC number to ask them to call to confirm are they at risk, or what should they do next. I think as a pharmacist or as a healthcare professional, we have to always balance between business and also the well-being of our customer. So I think this will be my personal sharing for today, about pharmacist talk, and then things that we pharmacists really want the public to know.
Yeah.
So as John, to wrap up the part, do you have any other thing you want to share?
I would say appreciate your pharmacist that talks to you, because I do know there are certain practices in certain pharmacies that they don't, because it's a waste of time. For pharmacists, it's also very busy most of the time, handling the orders, etc. Do appreciate pharmacists that actually come to the counter and talk to you, because that's very precious. Similarly, like when you talk to a doctor, you pay for the hour. Now you're not paying the pharmacist for the hour, so try to use it. Not to waste too much time, but try to use as much of the time of a pharmacist to ask your questions. Yeah.
Yeah. So I think that will wrap up for the session today. So if you don't have any question, we'll probably wrap up for today Health Huddle. So thank you, John, for joining us today. Thank you for those who tune in today. Do help us to share this live if you think is beneficial. Today we are talking about things that we pharmacists want the public to know, and then we have been talking about antibiotics. We talk about how you should consuming the pills in the right way. We also talk about what is generic drugs and what is innovative drugs. And lastly, we talk about if you want to request a drug from a community pharmacy, what you should actually tell the pharmacy so that we can ease the mistake of giving wrong drugs or saving the time for both the customer and the pharmacist. So thank you for all of us who tuned today. Again, happy Chinese New Year to everyone. Do take care and stay safe.
Thank you. Thank you.
Thank
Take
you.
care,
Bye-bye,
everyone.
everyone.
We cannot make sure that every hair strand we have the follicles with it. And also for the freshly plucked hairs, maybe we can get a better result.